All right. So welcome everybody. My name is Robin Devine. I am the owner of the Lymph Balance Center here in Calgary, Alberta, Canada. I am also a lymph drainage therapist. I'm a certified lymphedema therapist, and I'm also an instructor for the Chickley Health Institute out of the US. And so I teach lymph drainage internationally around the world. And I am very excited because lymph drainage is becoming more and more common, as well as gaining popularity in regards to not only regular day-to-day swelling, congestion, irritation. We're looking at conditions that have chronic inflammation, et cetera, but it's also becoming very accepted and very commonplace to see around surgery. So not only are we talking about surgery in general, we are also talking about cosmetic surgery, plastic surgery, joint replacement surgeries, et cetera. So one of the big things is these days you can go onto YouTube, you can go and do a lot of searching, and you can find a lot of information and see a lot of videos of people doing lymph drainage therapy. And we want to be able to clarify some of the most commonly asked questions that we get at our clinic. And so I'm going to walk you through a little bit about how we approach lymph drainage therapy with cosmetic surgery, plastic surgery, but in general, you can also look at this as being applicable to any surgery. So the first thing we always want to share is, how does your lymphatic system work? So we know that we can go on to any kind of search engine and get some very varied responses and breakdowns of what each system does. But in a nutshell, your heart pumps out lots of beautiful things in your blood to all of the cells around your body. And that includes oxygen, that includes nutrition, that includes water, all these things that all of your cells need every single day. And your cells in turn go, thank you so much, and they give off the waste products that then we need to be able to process and deal with. And for the longest time, we believed that all of that was being transported by our venous system and then circulated around, but it has now been shown that 99.99% of all the waste products that your cells give off, including excess water, hormones, tumor cells, broken down cells, if we look at bacteria, viruses, all of those things actually get picked up by our lymphatic system. So your lymphatic system is found anywhere in your body you have blood. So there's very few tissues in the body that do not have lymphatic fluid and are not draining that fluid to be processed. So on this picture here that you see on the right-hand side of your screen, the lymphatic system is anywhere you have capillaries, which are the smallest blood vessels. So what happens is it picks up the waste products, the things that your tissues don't need anymore, that can be excess water, et cetera, and it's going to take that fluid and it's going to take it towards lymph nodes. And lymph nodes do an amazing job of cleaning, filtering, attacking any viruses, bacteria, making sure that the rest of the fluid that is eventually going to make it back into your bloodstream is as clean and clear as it possibly can be. So that's what you're seeing here on this slide. So these are some images that we can show. Different artists, again, me and hanging out on the internet always gets me some of the best images. And so this is looking at the lymphatic system all around your body. So we know approximately you have, let's say, on average, around 800 lymph nodes in your entire body. Half of them are found in your abdomen alone. So they're hiding deep, deep, deep to all of your intestines, all your organs, et cetera. The picture on the far right, that is looking at the superficial pathways just underneath your skin of how the lymph moves. And so you'll actually see, I'm going to bring my little cursor over, you're going to see that there's this like dividing line where the lymph is actually going up towards the armpit here, or it's going down towards the groin. And that's really important. This thing right here, and it happens right down the midline, we call those watersheds. The way watersheds sort of help your body is they help organize, where is the lymph in your body going to go? Which lymph nodes are they trying to get to? So the image in the middle, you'll see there's these nice, beautiful blue lines. And those lines are representative of the watersheds, the superficial, the skin watersheds, which is really important in regards to cosmetic plastic surgery. These watersheds are what helps your body decide, hey, if I've made lymph on the right-hand side of my body, I'm going to take them to lymph nodes on the right-hand side. If I make the lymph, let's say if we look at this picture here, above this watershed, which is going right across the belly button, if I make it above, it's going to go up to my armpit nodes versus if I make lymph below that tissue or below that watershed in the tissue, it's going to go down to the groin. So watersheds are these non-structural boundaries. It's not like a fence. It's not like a wall, but it helps your body decide what is the fastest, most efficient way to get the lymph that's made in that tissue to the closest lymph nodes possible. Because lymph nodes are the job, they're going to go and clean all of that fluid. Because remember, there's those waste products, etc. So the reason why we care about these beautiful watersheds is because, very specifically, when we look at plastic surgery or we look at cosmetic surgery, we're going to change where the skin is. We're going to maybe do a nice cut across the lower abdomen and the skin is going to be pulled down. Or maybe we're going to do an incision around the breast and it's going to help, take out some of the excess tissue to give us a nice breast augment. Or maybe they're going to do an incision along the sides of the body and give a little bit of a tightening within the tissue. So when we go back to that picture before, and we see these lines, can you imagine if we took the abdomen, the abdominal skin right there, and we pulled it down, what happens to that watershed? It gets shifted as well. So there's a lot of cool things that happen with plastic surgery or any surgery in general. And so the more experienced a lymph therapist, the more that they can map and feel which way the lymph is going, because the pictures we just saw are beautiful textbook pictures. And textbook pictures are great, but it does not represent the majority of the population, especially when we go and change the position of the skin. So if we do a lift, if we do a tuck, if we do a part of the skin being removed, like somebody who's having an apronectomy, having part of the abdomen removed because they've lost a lot of weight and they want to take that excess skin that's coming down over the abdomen and remove that, that's going to change the way your skin drains. And so that's one of the things that I love about being a therapist, is that we get to go and find which way your body is draining and getting the best movement of fluid. So once we get all that lymphatic fluid, all the waste products that have been sort of pulled from all those tissues and brought along those channels, and now we go to lymph nodes, and lymph nodes are amazing. I think lymph nodes is one of the most innately and just intelligent things found within the human body. And what happens is that the fluid comes into the lymph node and it goes in, and you have all of these areas where we have cells. We have lymphocytes, which are lymph cells, immune cells. And these immune cells are amazing. They go and they attack anything that's foreign. They're looking for viruses, bacteria, parasites. They're looking for dead pieces of fragmented cells. They're looking for things that are foreign. So sometimes they find tattoo ink, and sometimes they find pieces from like mascara, or maybe they find a dye that you ate or ingested. I can only imagine with a lot of the very unnaturally colored foods that we have. So all those things get pulled through our lymph nodes, and our lymph nodes attack and create an immune response. And I love that. That's your body's job at work. Lymph nodes, when they're swollen and congested and they're uncomfortable, it's common like when you have a cold or you've gotten a virus, that's your immune cells, and they're working hard, and your lymph nodes get a little inflamed, congested, a little bit tender, and that's a good thing. That tells me that your immune system is working. And that's one of the ways, doctors always, they come and check underneath your jaw and they check along your throat and they go, oh, you're not feeling very good. And that's a good thing. That's your lymph system working for you. That's your immune response. I love that. And so we want to make sure that this node, these groups of nodes are really, really happy and highly functional going into a surgery, but also after surgery. So very important to keep them happy and working efficiently and at 100%. So what are even the benefits of doing lymph drainage therapy before surgery? So I could spend a whole day just telling you about all the benefits of doing lymph drainage for any tissues within your body, to be brutally honest. But there's a lot of really great reasons to get it done before you go into surgery. So the first thing that happens is we want to make sure your tissues are super happy. So if you're going to be going in and getting a facelift or a tummy tuck or a 360 lipo BBL, or if you're going to go for a breast augment or a breast decrease, or you're going to go for pec implants, or you're going to go for microsurgery just to even help the upper eyelids so that way it's not as congested, etc. So we want to make sure that the tissue that's going to be worked on is like super duper happy, healthy, as decongested as we don't want to have waste products in there. Imagine going in and doing an incision and having these waste products in the tissues. That's going to make it more difficult for the surgeon. You're inviting an infection. It's going to make it more irritated as tissue. We want that tissue to be as clear and clean as possible. So we want to make sure that that tissue is as decongested as possible. We don't want to have any edema. We want to get all the toxins out of that tissue. And to prepare the tissues like that is really beneficial. But additionally, when we do lymph drainage therapy on anyone, by stimulating the lymphatic system, what happens is we also stimulate the immune cells to produce more lymphocytes, about 30% more lymphocytes. So by doing lymph drainage therapy, we are stimulating your immune system to be producing more immune cells, which is awesome because think about it, you're going in for surgery, you're stressed, which brings down your immune system. You're maybe tired because you've been anxious about the surgery. That's going to bring down your immune system. You haven't been able to eat for how long before the surgery. You might be slightly dehydrated, not the greatest for surgery. And then you're going to be given medications and all these things that your body has to process. So if we can go into a surgery with a boosted immune system already, that's going to give us a greater chance of preventing postoperative infection, faster healing time. You're going to have less congestion in the tissues because once you cut tissue, it has to heal. And to heal, it has to go through an inflammatory, natural process of healing. And so by doing this, you are taking out the edema and all the swelling and anything that's there before, so that the process that happens is the only process that's going on. It's not dealing with crap that was there from before. We're dealing with just the surgical stuff. So we're able to go in and help boost your immune system while getting the tissues all ready before you even go in for surgery. So we do lymph work after surgery because it's going to help prevent, again, that infection. It's going to be stimulating your immune system. It's going to, by moving the excess fluids out, it allows for more fluids to come in. And when I say more fluids, I mean like fresh blood, fresh oxygen, lots of nutrients, more water. And those are all things that your cells need to heal. So by doing lymph drainage after surgery, we get rid of all of the excess inflammatory stuff that doesn't need to be there. We get rid of maybe some scar tissue fibers that are no longer needed. It's going to, if there is an infection, help move that stuff out to the lymph nodes so we can attack it and heal through the infection faster. And by moving the excess fluid and bringing in healthy blood, water, etc., it's going to help prevent muscle spasms and even the little microspasms that happen around the tissue that is trying to heal and reconnect. That's going to decrease. And you're also going to help with pain. You're not going to have the excess fluid that pushes on all your pain receptors in the tissue. And it's going to help with a generalized detoxification. So really, really great reasons to get lymph work done after surgery. So what do we normally recommend for pre-surgical schedule? So this is a very, very common question, and everybody's a little bit different. It's different if you're having one mole removed versus if you're having a lipo 360 BBL, or if you're having a huge tummy tuck, etc. So if it's the first time you've ever received lymph drainage, we're going to be cautious. So anybody who comes to our center and receives a lymph session, the very first session is never longer than 30 minutes. And there's a good reason for that, is that in 30 minutes, even though lymph drainage is exceptionally gentle It is never, ever painful. And it's very relaxing. If your body happens to be dehydrated, or you happen to be stressed, or you happen to have a lot of trouble sleeping, or you're not processing urine very well, you might have some of the negative effects associated with receiving lymph, which is most commonly headaches, feeling nauseous, a little bit hungover the next day because you're dehydrated. And so if it's the first time you've ever received lymph drainage, we normally suggest that we do our very first session at least 1 month prior to your surgical date. And that gives us the ability to make sure that your body responds as best as it can. It makes sure that you're going to get the very best results and that we know how your body's going to respond to the session. So if it's your very first session ever, we do suggest that your first appointment be at least 1 month prior to your surgery. Based on how everything goes and how you feel the next day or 2 or even 3 after the session, we'll then say, probably let's do another session in 2 weeks, which is now 2 weeks prior to your surgery. And every time we do a session, it doesn't just work while we're working on you. It also continues to stimulate your lymphatic system for the next 2 to 3 days. So really, having a session on Monday will continue and keep your system working optimally until Wednesday, maybe Thursday. So for that reason, the last session we do with you prior to surgery would be anywhere between 3 to 7 days before your surgery. We won't do a session the same day unless your surgeon has directly asked for it. And at that point, we do still talk to your surgeon because there are some potential complications. But having it 3 to 7 days means that we've stimulated your system, we're getting lots of fluid movement, and that it's not going to impact how the surgery goes in the sense of potential medications or processing potential problems that might happen. So we do know that by doing lymph drainage, and if you're on medications, it can change the way your body processes those medications and gets them through and out of your system faster than what they might have been originally intended for. So one of the main reasons we don't do lymph drainage on the same day of your surgery is it might change the way that either the anesthesia or any medications that you're taking on the day of surgery might work. And I don't know about you, but if I have to go under general anesthesia, I want to make sure it works to the best of its abilities. And I don't want to feel any kind of concern about, oh, maybe it goes out of my system faster and all of a sudden I can feel the discomfort faster. So that's definitely not something we want to do. Post-surgical schedule. So we actually can start working on somebody after they had a surgery within 24 to 48 hours. Now, this is a cautionary thing. We don't do this all the time. There's a lot of really great reasons to do this. Now, obviously, if you have some sort of post-operative infection, we'll not be doing lymph drainage until the infection is under control and has been eliminated, basically. But within the first 24 to 48 hours, I can treat you with lymph drainage. It'll help stimulate your whole immune system. It's going to help move fluid, help you eliminate, if there's medications that you were on for the sake of the surgery, you want to clear those out of your system. We want to start the detoxification process, starting to get things processing through, but I'm not going to work on the scar. To be honest, I'm not going to touch your scar until it's mature. It has to be at least 6 to 8 weeks old. And the reason for that is lymph drainage therapy requires a minimal amount of skin stretch. And if I'm stretching the tissues that are part of your scar, part of the adhesion that is now holding everything together, and your plastic surgeon or your cosmetic surgeon is trying to make the most beautiful scar and keep you as happy as possible, the last thing you want me to do is go put tension on that scar. If I go and do any stretching movements and it pulls those two edges apart, that scar is not going to be as happy or as pretty as it could have been. So we actually don't work on the scar for at least 6 to 8 weeks, but I can do lymph work in 1,000 other places. And anywhere I do work will stimulate your immune system. And because your lymphatic system is all connected, if you have a scar on your big toe and I can't work on the big toe, I can work on your neck, I can work in your deep abdomen, I can work on your thigh, I can work on the shin. And all of that is going to have an indirect effect. It's actually going to boost your immune system, but also assist in the drainage of excess fluid, edema, inflammation from around that big toe, and help it move without me even touching the skin around it. Now, once that scar is 6 to 8 weeks mature, that's when we can actually start doing some really great work to help diminish the appearance of that scar. So I want to be going in, and we have some amazing techniques like lymphodefascial release. I can do some lymphatic techniques that actually help break down fascia and get that scar to be nice and smooth and fine, and get it to be even in its color tone and minimize any kind of pull on the tissues around it. So there are a lot of really great reasons to do post-surgical lymphatics. So what is not lymph drainage therapy? There are a lot of videos out there, and I apologize, it's really not that pretty of a video here, but if you see somebody doing lymph work and they say it's lymph drainage and it's pushing fluid out through an incision, this is called excisional or incisional drainage. That is not lymph drainage. This is absolutely not covered or not legal unless you are a doctor or even an RN. So to be able to get the fluid to come out of a scar like that is a huge contraindication. That means that there is an opening in that scar. It is not safe. And for that reason, you need to be seeing a doctor or a nurse. That is not lymph drainage therapy. The other one that I didn't get a really good picture of, but lymph drainage therapy is also not very deep. It should not be painful. It should not be the most common thing that I get, and I've had this with people who've gone for surgeries in other countries. They come back and they say, all right, Robin, I'm super excited about my session today. Don't worry, I've taken my T3s. I'll be okay. And I sit there and I go, I have no idea what you think I'm about to do, but this is not painful. What are you expecting? And they're like, oh no, the lymph drainage sessions that I've had other places, I have to breathe through the discomfort. And if I don't take pain meds, I'm screaming. And that's not lymph drainage therapy. Lymph drainage therapy post-surgery is to help your lymph system properly move that lymph fluid to the lymph nodes, to clean it, clear it, put it back into your bloodstream so your kidneys can evacuate the excess fluid. I should not be pushing fluid out through an incision. I am not going in with a needle and taking out fluid, and it is never painful. So those are definitely not lymph drainage therapy. So how do you know if lymph drainage therapy is even right for you? So when we look at surgeries, I want to know a lot about you. I want to know what your health is going into that surgery. I want to know, can your heart, your kidneys, your lungs, can they all handle me encouraging more fluid to go back to your heart, which then has to move it to your kidneys and filter it? So if you are on dialysis or you have heart issues or your kidneys are not functional, these are problems. And those are things that mean I can't do lymph drainage therapy for you. What we do know is that for some people, lymph drainage therapy is what's going to take them from a very stressed, sympathetic sort of fight or flight state into a very relaxed, parasympathetic state, which allows you to de-stress and to unwind and to be able to mentally prepare. So for some individuals, they'll get lymph drainage therapy not only for all the amazing benefits I already stated, but also as a calming process. Sometimes we need to talk to the doctor and we need to say, hey, is this something that you feel is appropriate for this client? If people are on extreme medications, then it might actually not be a great idea. So a lot of the times, at least in our clinic, we do what we call chart reviews. And so we have potential clients fill out our whole health history form with all their details on it. And then one of our therapists or myself will sit down, look through the whole chart and see if this is an appropriate pre-surgical or post-surgical therapy plan, and if it fits right for their body and for the type of procedure they're about to go through. So everybody's different. I've worked with pre and post dental surgery. I've worked with pre and post heart surgery. I've worked with a lot of cosmetic surgery, a lot of plastic surgery, a lot of joint replacements. So there's tons and tons of reasons to do it, but there are exceptions. And so it is very important that your therapist goes through and looks at all the parts of your health history, making sure it's safe. So there are a lot of exceptions and there are a lot of little intricate pieces to pre and post surgical lymph drainage. And so this is our contact information. You are more than welcome to send me a question or check out our website, etc. But just know that there are lots of options, ways to help make the surgical procedure easier, ways to help make the process less painful, assist with your immune system, and also decrease the appearance of the scars and any kind of pocketing fluid around the surgical incisions, help with the healing process, and have a better overall surgical procedure and experience itself. So if you have any questions, there's our email address, there's our phone number. You're more than welcome to contact us and ask as many questions as you possibly can. And we'd love to hear from you.